It's great to be here today and to see so many people joining from the Q community. And myself, Charlie, Tom, and Ioma are going to be talking today about different aspects of environmental sustainability in healthcare. So bringing you a bit of a roundup of where the Health Foundation is at on sustainable healthcare and work we've done so far, as well as our areas of focus in this topic for the future. And Ioma will be focusing in on sustainability and quality improvement. And we're also really keen to hear from you about the work that you've got going on at the moment and what you'd like to see from the special interest group and the Q community going forward to support you in that. So my name's Caitríona. I'm a GP registrar by background, and I'm based here at the Health Foundation this year as one of the NHS Chief Sustainability Officer's Clinical Fellows. So my work is themed all around environmental sustainability of health and care. So to put in context environmental sustainability's sort of position at the Health Foundation, for anybody who's less familiar, the Health Foundation is an independent charity committed to bringing about better health and healthcare for people in the UK. And it does this through a range of means, both from giving grants to frontline improvement programs, supporting communities of practice like the Q community, as well as both commissioning and doing in-house research and analysis, all with the aim of influencing and improving policy and practice. Now, this slide does slightly make my head spin, but on the left, we can see the three priorities of work at the Health Foundation in our current strategy. So improving health and reducing inequalities, supporting innovation and improvement, and improving health and care policy. And then you'll see on the right that across all of these, we have cross-cutting themes: public participation, equity, diversity and inclusion, and environmental sustainability. So this is relevant to all of our priorities, and we recognise this because of the growing impact of climate change on health, as well as the need for health and care to decarbonise. And it's in recognition of our role as a funder and a research body of what we have to bring to this work. So I won't spend long on this, but just to touch on the reasoning behind our focus on environmental sustainability, and it really goes back to the health impact of the climate and ecological crisis. So I really like this quote from Dr. Tedros Ghebreyesus of the World Health Organization, that we need to safeguard the health of the planet on which human health depends, and that it's absolutely fundamental to health, and that's why it's core to our mission. And the role of the NHS in this is not only that with the health impacts of the climate crisis, the health system will be at the front line of seeing these impacts, but also that the NHS is itself part of the problem, contributing 4% of the UK's carbon emissions or 40% of public sector emissions. So it also needs to address its own contribution. And to that end, the NHS was the first health system to commit to net zero for 2040 for its own directly controlled emissions and 2045 for the emissions it influences. And that ambition is now embedded in legislation with the Health and Care Act 2022. And progress has been made with all NHS trusts in England now having a green plan. And there are similar national strategies in the developed nations, such as Wales having a public sector net zero target of 2030 and NHS Scotland having its own net zero target of 2040 as well. So in thinking about this ambition, we wanted to think about what does net zero care look like and how do we get there? So at the Health Foundation, in our recent long read entitled Net Zero Care, What Will It Take? We adapted some of the principles laid out by the Centre for Sustainable Healthcare to set out what we thought were key drivers of low carbon care, because ultimately to achieve net zero care, we have to both reduce the need for healthcare through better prevention upstream, reduce the emissions of healthcare that is delivered, through a range of means, and ultimately and eventually offset the minimal remaining emissions. So the key drivers we have here are, as I say, preventing disease, improving the management of disease and health, moving care out of hospitals, eliminating avoidable waste and unnecessary interventions, and using lower carbon alternatives where it's not possible to prevent or sort of make leaner the care pathway. And I'm just going to give you a couple of examples of each of these drivers, focusing in on these areas. So one is on improving the management of disease and health. So there was in 2021, a regional pilot scheme in Thames Valley to roll out the use of blood testing to stratify pregnant women for their risk of preeclampsia. And this was to address a need in that prior to this test, it was hard to predict whether a woman would develop preeclampsia, which has a lot of health risks for mums and babies. And so they would often need to be admitted to hospital as inpatients for observation, which is obviously both disruptive for individuals and sort of a great resource need on hospitals and planetary resources as well. So this blood test was proven in trials, and then the Academic Health Science Network worked to embed it in practice. And importantly, rather than add it into existing care pathways, they took a whole care pathway approach to ensure that the maximum benefits across the triple bottom line of patient outcomes or social outcomes, and as well as financial and carbon benefits, could be realized. And I'm not expecting you to be able to read that flowchart, but just to illustrate that the whole care pathway was looked at as part of a environmental review of the innovation. And this showed that in just one centre over 1 year, almost 400 admissions were safely avoided through the use of this test, as well as a saving of money and carbon emissions and waste through this change in care. And indeed, since then, this blood test has been adopted into national guidelines for care of pregnant women. And then to look at another area of using low carbon alternatives. So surgery is a very carbon intensive area of healthcare. And because of that, the Health Foundation commissioned the Green Surgery project led by the UK Health Alliance on Climate Change and the Centre for Sustainable Healthcare, along with Brighton and Sussex Medical School. And this is one of the examples from that report, which was published in November. So the image I've taken from an artist's video where she gathered all the equipment that would have been used in her surgery as a patient, showing the scale of the use of single-use items in surgical care. And so an innovation that was used in Cornwall, and again in partnership with an academic health science network, as well as a UK-based reusable medical textile business, was to use reusable surgical gowns and drapes rather than single use. And again, showing the benefits of taking a holistic view of an improvement or change program. They recognized that in switching over to reusable, they'd have to undertake sterilization processes, which can be very high temperature and high energy use. So they developed and validated the safety of a lower temperature decontamination process. And again, in this small pilot, there were substantial carbon and financial savings with no issues or changes to patient care, really. These are some of the examples that we have in our long read, but I'd love to pass over to Ioma now to talk about the concept of sustainability in quality improvement at the Centre for Sustainable Healthcare.
Thanks, Caitríona. So my name's Ioma. I am a HIV and sexual health registrar by background, and I'm on an out-of-programme experience at the Centre for Sustainable Healthcare. And we have a team, a SUSQI team, and I'm going to talk to you guys a little bit about how we work and collaborate with people. So just back to the previous slide. Thank you, Caitríona. So we think that very often the idea of sustainable healthcare can be a little bit overwhelming. And the idea of SUSQI is it's a vehicle to adopt the principles of sustainable healthcare And those are our secondary drivers that you see on the driver diagram here. So ultimately, our aim is to improve health, but to also reduce the carbon emissions and greenhouse gases associated with healthcare delivery. But we believe that by implementing improvements that use prevention, patient empowerment, lean pathways, low carbon alternatives, and operational resource use, that we can drive towards meeting that outcome and those aims. Next slide, please, Caitríona. Thank you. So in green, this is our SUSQI framework, which was created in collaboration with some other partners. It's designed not as an additional tool, but to work within current QI practice and current QI theory. So there's 4 steps of setting the goals, and that's with recognition that we do have finite resources, being environmental and financial resources, and sometimes we have to set our goal with climate in mind. To then study the system, so to understand where environmental, social, and financial resources are being used in the current system, and then to use those principles of sustainable clinical practice to design improvement. And then when we're measuring impact, to consider sustainable value. So if you could just click next, Caitríona. Thank you. So this is our sustainable value equation. And it's a family of measures that we encourage people to consider when you're doing QI and improvements. It's trying to balance always first and foremost our outcomes for our patients and population, but to balance those against environmental and financial impacts, but equally important to try and add social value at every step. Next slide, please. I feel like Chris Whitty. Thank you. So SUSQI in practice, we do a lot to support people. And if you could just do one click, please. The first thing is our SUSQI education project. So we ran this as a pilot in collaboration with the Health Foundation, and we have collaborated with the Health Foundation a few times on green space projects and also carbon footprinting projects. But our education project was a pilot to try and embed SUSQI within healthcare educational institutes. And it's something that's gone very well, and I'll talk a little bit more about when we talk about our academy program. But this website, which is our susqi.org website, and the QR code is there, also has a step-by-step free guide to do your own project if SUSQI is something that you'd be interested in. We also have facilities to teach others, so we have a free educator pack, and those can all supplement the courses that we run on SUSQI and teaching SUSQI. We also have our Green Teams competition, which if I just ask you to click once more, this is an example of, so I don't know if you can see the bottom of the slide, but we collaborate with healthcare organisations, both in the UK and now hopefully internationally as well. And we support them to deliver this competition, which tends to be made up of about 4 to 6 teams. And we support them from design to delivery to measuring the impacts of their own SUSQI projects. And this is quite a significant example of one which was done about 2 years ago in 2022 within an HIV department in Northamptonshire. And they changed their pathway. So they focused their design improvement on lean pathway. So normally we see patients every 6 months, regardless of how stable they are. And they decided to supplement one of their 6-month or substitute one of their 6-month reviews with a telephone consultation instead. And what they found, as you can see in this infographic, is they saved about £44,000 a year annually was projected, and to save 25,000 kilos of CO2 equivalent gas, which is the equivalent of driving 74,000 miles. But also that their patients were not having to take time off. A lot of them actually, they found out, were in 0-hour contracts and having to lose income from attending their appointments, which they didn't want to disclose necessarily why they were having to come into hospital. And staff saved hours of work, which could be reallocated to more high value appointments. So that's an example of how SUSQI in practice can really significantly improve the health that we provide. Next, click please. Thank you. So our SUSQI Academy is a program that we run. It's a package basically to support people in embedding SUSQI within their either healthcare delivery organisations or educational institutes. People are really enthusiastic about SUSQI and sustainable healthcare, but they don't always have the capacity or the expertise to do it. And so at CSH, we've developed this package to try and support people to do that. And I think that's the end.
Great, thanks, Ioma. So I'm going to talk to you a bit about what's needed to transition to net zero care. We've heard a bit about what net zero care is and what it can look like in practice, but what do we need to actually enable that at scale? So through our research, we've identified 4 main areas that action for senior leaders and policymakers should focus on to enable the shift towards net zero care. I'll talk through all 4 of these briefly, but I'll go into the first 2 in a bit more detail. So the first key area is investing resources to shift low carbon care models. A lot of this is about human resources and the capacity and capability to plan and make changes to health and care practice. Our second area is putting sustainability at the core of good leadership, ensuring that it's at the forefront of decision making and that it aligns with other strategic priorities. Our third area is all about policy levers that helping, not hindering the shift to low carbon care. So care delivery is shaped by a vast range of nationally directed conditions, guidelines, incentives placed on leaders and managers. However, the majority of approaches that are currently used aren't designed with net zero in mind. So we want to think about how we can inform more supportive policy and what the role of national levers in supporting NHS net zero are. And then the final area is supporting research and innovation to enable faster decarbonisation of care. So there are difficulties measuring the environmental impact of products and pathways, and there's a lack of a standardized measurement and reporting approach, which makes it difficult to understand where we can best target pathways to have the greatest carbon reductions. So what we want to try and achieve here is a building of the evidence-based, so thinking about funding for research to understand and characterize carbon hotspots and what care models, medicines, and devices should be prioritized. Brilliant, thanks. So focusing in on the first 2 key areas of change, these ones link most closely to sustainable QI initiatives, which is why I've picked these 2 to talk about today. So 2 key themes came from the first key area of investing resources to shift to low carbon care. Firstly is capacity. So we've heard time and time again about the reliance on volunteerism to do sustainability work, individuals within the NHS who are taking on sustainability initiatives on top of their already high workload. And depending on the goodwill and enthusiasm of people who don't have protected time for sustainability, it's an unsustainable thing to be doing and insufficient to meet the need or the scale of the challenge. Healthcare workers need time, space, and resources to improve the sustainability of healthcare. And we have seen some good examples of this in practice where trusts are creating protected time for clinical staff to work on sustainability. And some ICSs have appointed clinical fellows to catalyze action, but it's nowhere near enough to meet the scale of change needed. The other key area is capability. So there's a skills and knowledge deficit as well as a capacity deficit, and awareness of the net zero ambition among NHS staff is still really low. We did some public polling and found that less than half of NHS staff are aware of the net zero target. But on top of general awareness, there's also the need for skills and knowledge to understand what changes are needed and how to implement them. Environmental sustainability needs to be embedded consistently across professional groups through undergraduate and workplace training, And this is reliant on coordination and partnership between organisations such as NHS England, professional membership bodies, and universities, and NHS providers and ICSs, as well as others. So there are key capabilities that the clinical staff need to deliver more sustainable care. This could include mapping the care pathway or the service and identifying opportunities for change, could be co-producing more sustainable approaches to care, or testing and measuring the impact of changes. And building on the concept of sustainable QI, there's an opportunity to normalize sustainability when thinking about the quality of care. Next slide, please. So another issue that has surprisingly jumped out is the importance of leadership. And the obvious point here is that net zero care can only be delivered if organizational leaders place environmental sustainability at the forefront of decision making. And this includes clinical leaders who are in a strong position to design and lead changes to the services they deliver, and they can play a really important role in educating and influencing others. And the big issue is that the multitude of big urgent challenges that leaders face within the NHS are often crowded out by other more important issues. So sustainability is often put on the back burner. But as we've heard from Caitríona, we know that we can address these important priorities, whether that's reducing wait times, improving quality and safety, improving patient outcomes, as well as achieving more sustainable practices. So there are some really good examples of this. UCLH is one of them. And in 1 year, they've saved over 13 million miles of patient travel and 1,300 tons of carbon emissions by delivering nearly 500,000 appointments virtually, which was 40% of all of their appointments. And another point here is that prioritizing sustainability, unlocking resources, and protecting staff time all rests with leaders. So this requires an awareness in leaders of the importance of shifting to low carbon care and how we can do that. And a key point here is that it must align with national strategy. So leadership training needs to be delivered at a larger scale, building on programs developed by the Centre for Sustainable Healthcare, for example. And this sort of golden thread of alignment needs to run throughout the whole organization and in collaboration with other organizations and systems too.
Great, thanks, Charlie. So I'm just going to finish with a few minutes, just giving you a bit more of a flavour of some of the work that we've done at the Foundation on sustainability over the years, and also what our plans are for the future. So if you go to the next slide, please. So to date, we've undertaken a range of projects that have an environmental dimension, and these have largely focused on supporting the ambition of a net zero NHS. So we've undertaken research and analysis on some aspects of sustainability in the NHS to inform policy, and Charlie mentioned the long read that we've recently published, and we can share a link to that afterwards, and has a number of kind of areas that we've been exploring over the last year that we've drawn on for this presentation. We've also been supporting professional capacity development on sustainability in healthcare, for instance, through a fellowship at the UK Health Alliance on climate change, and that was focused on net zero surgery, which led to a report that you can see in the middle of the slide, which came out towards the end of last year. And if you haven't had a look at that, definitely recommend you checking it out. And then we've also funded frontline change projects with direct and indirect effects on environmental sustainability. So, for example, a project to scale up virtual consultations, which has helped to reduce patient journeys quite significantly. And then we also supported the organisation called Greener Practice to develop an asthma toolkit to help reduce emissions from asthma care. Next slide, please. And then in addition to this, we've developed an immersive installation that we've got in the office at the moment that imagines the NHS in 2036, so 4 years away from the net zero target for the NHS, where we've imagined the service has made really good progress, but there's still quite a long way to go to reach the target in 2040. And through the installation, we consider what care could look like in 2036, and it tries to explore some of the questions that raises, as well as helps people that come to the installation to think about what actions might be needed if we're to get to the net zero target. We've been running sessions with people from across healthcare and beyond, and we're really keen to get as many people to see this as possible. So we're looking at events and conferences that we can take the installation to. And we're also thinking about how we can make some of the content available online. And if you're interested to know more about the installation, then please do get in touch with us, and we can chat to you about it. Go to the next slide. So just a little bit about our future work on NHS net zero. So we spent the last year thinking about what further work we can do in the space. And we've developed a portfolio with a set of aims and objectives which you can see here on the slide. And given the work that we've been involved with before, our kind of organizational focus to date, and our knowledge and expertise, we've decided to focus on care delivery itself. So less about kind of estates and energy and more about the shape of health and social care. And we're going to be exploring the changes that need to occur within health and social care delivery if we are to achieve net zero. Within this, we've got 3 objectives. The first one, kind of speaking to the point that Charlie made earlier about the importance of policy levers. We want to understand national health policy levers and how they can better support net zero care delivery. So there we'll be thinking about the mechanisms that are used to direct and influence the shape of care. So things like regulation, targets and metrics, payment systems, national guidelines, health technology assessments, and so on, to really understand how those levers can be better oriented with net zero in mind. And then the second objective is about innovation and improvement. So identifying and evaluating, as well as scaling innovation and improvement in support of net zero. So, you know, as Caitríona pointed out, there are lots of promising changes being made locally. Some of the questions that arise, though, are, you know, how do we assess these changes in a systematic way? How do we understand what works and why? How do we build the evidence about this, and then enable changes, those changes that have evidence behind them, to happen on a larger scale? And then the third objective is about building capability to implement change, speaking to that kind of capability deficit that Charlie mentioned earlier. So thinking about how we can support the building of skills and knowledge of people in the system to plan and implement low carbon care. And in terms of how we're approaching these objectives, we've started with objective 1, and we're planning a research commission on policy levers that we're going to hope to kick off later this year. Go to the next slide, please. So I just wanted to say a little bit as well about how we think about sustainability in relation to our operations. So we're very aware of the impact that we have on the environment, you know, as an employer of over 200 people, with a physical office space, with an investment portfolio, and as an organization that makes grants and also procures goods and services. So for the last few years, we've been working to reduce that impact. There's quite a long way to go, if I'm going to be honest, but I think we've made some good progress and we've done a few things so far. So firstly, we've completed quite an in-depth analysis of our carbon footprint. We've been working with a carbon accountant to build a much broader and detailed picture of our carbon footprint than we had before, going beyond kind of energy usage and travel to include the goods and services that we purchase, such as IT equipment, professional services, our office running costs, home working, commuting, and our endowment. And then thinking about our endowment, which is the biggest contributor to our carbon footprint overall, we've set a net zero target of 2035, and we want to see a 50% reduction in emissions by 2028. And to help us get there, we've hired a number of people that have expertise in sustainable investment to help us achieve those targets. We've also published some guidance on sustainability for our grant applicants, so to help them think about the potential impact on the environment of the projects that they're proposing, whether they're improvement projects or research projects. And then we're also creating an organizational-wide carbon reduction plan that will set an overall ambition for carbon reduction at the foundation, set out a series of principles to guide our work, and then also critically set out the actions that we're going to need to take to become a greener organization.